Thank you, Mr. Chairman, and I appreciate the witnesses coming today. I wanted to talk a little bit about a draft bill that I've been working on with the VA. It actually stemmed from a visit that Undersecretary Shulkin and I had in Alaska, where we were out in several different communities. And one of the big takeaways I believe he had from that trip was some of the big challenges that not just Alaska, but rural states who have big veteran populations who don't have enough providers to actually help with regard to a lot of the challenges that the VA has. So, and as you all probably know, there was a recent Association of American Medical Colleges survey that said close to 45% of doctors who do their residencies at certain medical schools end up staying there. Well, if you're like a state like mine where you don't have a medical school, you just kind of start with a challenge. So we've been working closely with the VA for months now. It was actually really, in many ways, Dr. Shulkin's idea last year that would have a pilot program for the VA to work with tribal organizations, particularly in states with heavy veteran populations, but are very rural states. So not just Alaska, but Montana, Wyoming, other places like that. And I know that I guess that we were just outside of the time frame to get your guys' official view on that. You said you needed 3 weeks. I think we got it to 2 weeks and 3 days ago. So if we didn't make it under the deadline, you know, I get that, but it'd be nice to be able to get the response. I'm almost certain that the VA is supportive, since in many ways it was Dr. Shulkin's idea, and we've been working with you and some of the other organizations interested in this for months now. So Dr. McCarthy, would you mind just giving a view on that, whether it's official or not? I think we're very close, and I'd like to get your view, and then we're going to work hard to get others from other states, other members on this committee to be co-sponsor that, but we want to make sure the VA was good to go with it first.
So we'd really like to get to yes. There are a few items that we want to work with you about. I totally agree with you about the training and where people stay. You're exactly right, and I do think that this would be really important. We have also, as part of the Choice Act, we're trying to expand residency programs significantly,
Right.
and so this is a good fit for us. There are some other regulations that we have to get through. I don't want to speak for all of them,
Okay.
But I'd be happy to talk to you more about it.
Okay, well, let's remember that we're also looking at a statute. So obviously, if a law would trump a reg, so I don't think, you know, we don't want to violate any regs, but we also want to make sure that we understand the hierarchy here, and this is a pretty important issue. And I know even Secretary McDonald has met with, you know, different Alaska groups,
Right.
and has been supportive of it. So already, I know we have top cover support from Undersecretary Shulkin, Secretary McDonald. For me, it's just really important to move this, and if we can get your commitment to move this, I think the chairman's aware of what we're trying to do on this. Let me ask, and you touched on it, let me ask a related question. That there were 1,500 new graduate medical education spots given to the VA through the Choice Act, and I think only 372 of those spots have been filled to date. So what's the issue there? Why are so few relatively to the number that Congress authorized have been filled, and is there anything we should be doing on that, or what should you be doing to make sure you take full advantage of the Choice Act provisions, which you referenced, and that, again, I think dovetail nicely with the bill that we're working on with you guys?
So the Choice Act gives us a 5-year limitation, and we really believe that building the relationships and building the residency programs is going to take more than 5 years. So there's a significant amount of lead time. I was involved in building residency programs in the site where I used to be a chief of staff, and it's not something that is done overnight. I'm a psychiatrist by training, was working to partner on psychiatry residency programs. You have to set up, you know, relationships with child psychiatry programs and so forth, because we don't have that in VA. You have to get people that are willing to to partner with you and so forth. So it's not something that can happen overnight, and those programs have to build their capacity and so forth, so it takes a while to build. I do think that expanding the choice recommendations to 10 years would help us a lot, but that said, there are a lot of efforts underway right now to try and partner as much as we can. I personally have a heart for doing that, especially in the rural areas, particularly for what you said about when people train in an area, they stay. There are a number of, for instance, osteopathic medical schools that have set up residency programs in rural areas, and that is exactly what's happening. More of them are staying in the area, which is, it's not something that happened overnight, but it does take a lot of time. So when you set up one residency program, family practice or mental health or whatever, there are other parts of residency that you need to get going at the same time. I'm sorry. You need to get going at the same time. So it takes building relationships with community partners, which is a very important work to do. There's a lot of goodwill out there. Some of the community partners are not of the interested necessarily in building their own residency programs. So there's convincing going on back and forth. And that's where we are right now.
Great, thank you. Thank you, Mr. Chairman.
Thank you, Senator Sullivan.